I'm Dr. Adduru. I'm a trained reconstructive foot and leg surgeon based here in Sarasota with Family Foot and Leg Center. So in the past, I have been practicing as a trauma and critical care nurse for over 10 years. And I was able to take care of multiple different people from different age groups. And this allowed me to also see healthcare in different perspectives. And eventually I became inspired to pursue podiatry, and I received my schooling in Temple University School of Podiatric Medicine, where I received my doctorate. And I was fortunate to match into HCA Healthcare West, which is one of the top programs in the country. And I was mentored by lots of world-renowned lecturers and speakers in the field that helps innovate this career that had been a very rigorous and well-rounded program that allows me to treat all types of foot and leg deformities. So what is enjoyable about podiatry? I found this career as a hidden gem. There are so many specialties that people are unaware about, include trauma, limb deformity correction, from bunions, hammer toes, to cavus and flat foot deformity. There's also sports medicine, there's wound care, there's dermatology, peripheral nerve surgery, and addressing peripheral neuropathy. There's so many specialties I could learn from and also help people with. It will never get boring. Technology is currently updating, and there's more treatments that we can provide for you. So here in Sarasota, we bring the most updated and cutting-edge technology to treat first metatarsophalangeal joint arthritis, or pretty much arthritis on the big toe. Back then, the gold standard was to fuse the joint and allow it to heal for 6 to 8 weeks. The problem with that is not many people like the downtime. You have to be off of your feet about 2 months, so it's quite some time. Now, with this update in technology and innovation, I have a different approach. This is called first metatarsophalangeal joint interpositional arthroplasty with a dermal allograft. What does that mean? Basically, I would put an acellular allograft that is made of a dermis that I would pretty much interpose in between the joint after I shave off all the spurs. This would allow immediate weight bearing, and also we would just allow the skin to heal. And I weight bear my patients right away, and they're gonna be able to walk. And what the outcome would be, you will be able to resume your activity without waiting for 2 months to heal. And all we need to heal is the skin. With that, I don't have to fuse your joint. You're not gonna have a stiff toe. You're gonna be able to walk right away and even regain function with very little downtime. A lot of people have issues with peripheral neuropathy that could be caused by mainly diabetics, but you could have chemical exposure if you're on chemotherapy, or back then, if you were a vet, you exposed to Agent Orange, or even nutritional imbalances. I believe in a more holistic approach where we don't rely on pills such as gabapentin, Lyrica, because that is a band-aid solution. How we would address nerves, especially if you have numbness and tingling on your toes, would be to address nutritional imbalance, and also we're gonna put you on vitamin supplementation for neuropathy. Also, addressing the actual nerves through peripheral nerve stimulator. This would eliminate the need for needles. And basically, the peripheral nerve stimulator would allow us to place an implant on the affected area, targeted with the nerve specifically. And basically, this just goes over the skin. And after that, we will have a rehab for you, help regain sensation and function to your extremity. And I have developed protocols to treat the nerves that is less scary than normal, and people have good clinical outcomes, and also there's clinical evidence that supports these type of treatments. One of the concerns that I see with parents who have growing kids would be the development of flat feet. So from age 0 to 1, the legs, the tibia, is slightly internally rotated or turned inwards. But from age 1 to 3, It's still slightly inwards, but it's correcting to a straighter position. But from age 3 to 6, we expect mostly developmental age that your leg would be straight. What we can do about that? It is normal to have some sort of developmental delay, but as a podiatrist, we can guide the kid to support deformity correction through good stretching exercises, supportive shoe gear, putting a more supportive orthotic, and possibly heel cups if they have heel pain. In terms of the heel pain, I could say that it's mostly normal because the growth plates have to fuse and they have to connect to the bones fully. And basically the cartilage turns into bone. And that is a painful process for kids. You could have over-the-counter anti-inflammatory as needed. You could apply ice and also just put him on a supportive orthotic for this type of problem. And we're gonna monitor the patient as the patient grows. And surgery is sometimes may happen, but it is the last resort. But we're just gonna continuously monitor the kid as they grow. One thing that I wish the patients knew before their visit is that when they have a certain problem, the sooner we see them as a patient, the more options we have and treatment that we can provide and prevent any problems from getting worse.